Perform hand hygiene while entering the patient's room. Introduce yourself and ask your patient's full name and date of birth.
My name is Maria Damian. I'm a nurse here at the School of Nursing at the Satoko Clinic. I just want to start off by asking your full name and your date of birth.
Aaron Charles Halfkenny, May 3, 1947.
Okay, that's what I have in the chart as well. So I want to explain a little bit what's going to happen. So I'm going to do a neurological assessment. So what that means is we're going to look at different movements. I'm going to ask you some questions. If at any time during that process you feel uncomfortable or you want to skip something, please just let me know and we'll do that. Do I have your consent to continue?
Yes.
Okay, and I'm wondering for the rest of the video, how may I refer to you? You can call me Maria. How do I call you?
Aaron.
Aaron, thank you very much. And I'm also wondering, what are your pronouns? For example, I'm she and her. What are yours?
He and him.
Okay, thank you. So I'm just gonna get ready with my...
Make sure you have gathered all the relevant information needed before starting any physical assessment. The complete neurological physical exam includes assessment of the patient's mental status, cranial nerves, motor system, sensory system, and reflexes. Ensure the patient's head is at your eye level. The mental status exam should be included in the overall physical assessment of all patients. Here, we will examine an abbreviated mental status exam as part of the neurological exam. Specifically, now is a good time to observe the patient's appearance and behavior, cognition and thinking. For appearance, observe the patient's posture. Here, the posture looks erect and the position is relaxed. Look for any deliberate body movements. Look at how they are dressed and general grooming and hygiene. Be mindful that there can be a cultural component to dress, grooming, and hygiene, and one must be respectful in how we discuss these and document. A great way to validate your own observations is to ask the patient,
do you notice any changes in your appearance?
When evaluating the behavior portion of the MSE, observe the patient's level of consciousness and alertness. Here, the patient is awake, alert, and aware of the nurse's presence and responds appropriately to questions. Observe the patient's facial expressions as you speak to them. Listen to the patient's speech. Here, the pace of the conversation is moderate, and the patient is able to articulate clearly and is understandable. Word choice should be effortless and appropriate for their educational level. Be mindful that there can be a cultural component, and this assessment will depend on someone's educational level. Assessing mood and affect can only be done by asking the patient how they feel. Observe body language and facial expressions in relation to the following questions.
So over the past 2 weeks, how have you been feeling, Aaron? What has your mood been like?
I've been fine. Not overly excited about anything, and nothing to be depressed about, just normal.
So no changes in your mood over the past 2 weeks?
No.
Okay, thank you.
Assess the patient's orientation to person, place, time, and ask these questions.
Where are we right now?
At the McGill Hospital.
At the McGill Hospital. What is the date today?
October 23.
October 23. And the year?
Yeah, I can't remember the year. 2023, I think.
Thank you very much. And who's the Prime Minister right now?
Justin Trudeau.
Attention and concentration can be assessed throughout the interview. Is the patient able to complete a thought without wandering? Note if the patient is distractible. Here, the patient completes his thoughts and is able to concentrate during the interview process. Memory can also be tested more formally. For example, you may ask the patient if they remember your name to test immediate memory.
Okay, and what is my name?
Maria.
Thank you very much.
Or you may perform a more detailed testing. Remember, you must have a way to verify that the answers are correct.
Okay.
When assessing thought process, content, and perceptions, ask yourself, does the patient make sense? Can I follow what they're saying? Here, the patient is thinking logically, coherently, and is relevant to the situation.
You're expressing what you want.
To evaluate insight and judgment, you can consider whether the patient understands their illness, the need for coming to clinic, and the consequences of such. Here, the patient has insight into the severity of the symptom and came to get further evaluation. Next, we're going to test the cranial nerves. Cranial nerve 1, olfactory nerve.
Block your right nostril. Okay, close your eyes and you tell me what you smell.
Coffee.
Okay, we're gonna switch. So close the other one. Yeah, close your eyes and you tell me what you smell this time.
Cinnamon.
Thank you.
The olfactory nerve is rarely performed in day-to-day practice. Cranial nerve 2, the optic nerve.
We're gonna start with the left eye. So you're gonna use this to block out your right eye. Okay, I'm just gonna put this at the right position. Okay, so I want you to start reading over here.
8745 63925
If the patient wears glasses, be sure to keep these on.
85 5742.
Look for any hesitancy or moving the card further away and closer.
Okay, that's okay. So now we're gonna do it on the other side as well. Okay, so we're gonna start off here.
Looks like 9988
Let's go up, back up here.
8880. Looks like 8
What about
again.
here?
8745.
Okay, thank you. So next we're gonna do, we're gonna test you're gonna hold on to that, and I need my own now. So next what we're gonna do is, I'm looking at your peripheral vision, okay? So I need to be about arm's length away from you, and I'm gonna block this one, and you're gonna block the opposite eye. So your left eye, perfect. All right, so try to make sure you're really covering the eye. Okay, so now what I'm gonna do is I'm gonna wiggle my fingers and I want you to tell me when you see the stimulus, okay? While looking at my nose. So we're really looking at your peripheral vision, okay? So,
See it now.
okay,
No, I see it. No, I see it.
okay.
Assess all quadrants. While keeping your fingers moving, move them from different directions, from top, bottom, right, and left. Gradually bring your fingers in from the periphery towards the fixation point. Ask the patient to respond each time they see your fingers.
Now I see it. Now I see it.
And,
Now I see it.
okay, thank you.
Cranial nerve 3, ocular motor.
So we're gonna look at your pupils. If you can just take off your glasses really briefly, I'm gonna ask you to put them back on. So I'm gonna look at my nose. I'm gonna shine a light in your eye, and I'm looking at the reflex I'm looking at whether it's constricting or not, okay? So just open your eyes wide, wide, wide.
Look for ptosis, drooping of the upper eyelid, seen in palsy of the cranial nerve 3 and myasthenia gravis. Check pupils for size, regularity, equality, direct and consensual light reactions, and lastly, look for accommodation.
Okay, so look far, and now look close. Okay.
Cranial nerves 3, 4, and 6, the oculomotor, trochlear, and abducens nerves, control eye movements. Because these nerves work together, they are examined as a group.
Imagine like someone's holding your head, okay? So can you look up here? Okay, and now down. Try not to move your your head.
Check the extraocular movements in the 6 cardinal directions of gaze. And look for conjugate movements in any of the 6 directions, which can cause double vision.
A little bit, okay? So look down here again. Okay, perfect.
Test for convergence of the eyes by asking the patient to look at your fingers as you move it toward the bridge of their nose.
Just look at my finger again.
Eyes can usually follow your finger to within 5 to 8 centimeters. Identify any nystagmus, involuntary jerking of the eyes, with quick and slow components.
Your eyes were moving together, which is all very...
Note the direction of gaze in which the nystagmus occurs, and the direction of the quick and slow components. Cranial nerve 5, trigeminal nerve.
So I'm going to start by asking you to open your mouth and then clench it, okay? So open and clench. Okay. Now
The motor portion of cranial nerve 5, the trigeminal nerve, innervates the muscles of mastication.
I'm just going to ask you to close your eyes.
The sensory portion of the nerve,
And I want you to say now when you feel it, okay?
No.
Okay.
No. No.
the sensory portion of the trigeminal nerve has 3 divisions: ophthalmic, maxillary, and mandibular divisions. To palpate the temporal and masseter muscles, ask the patient to clench their teeth.
Clench your teeth again. Thank you very much.
Note the strength of muscle contraction, and then ask them to move their jaw from side to side.
Just wondering, are you able to do this? As if, like, imagine you're moving your jaw from side to side. Okay, thank you.
Cranial nerve 7, the facial nerve.
Okay, so now I'm gonna ask you to do some movements of your face, okay? I'm gonna ask you to lift your eyebrows, okay? Frown as if you're really upset. Yeah, can you puff your cheeks? Okay, I'm just gonna, okay, thank you. And can you show me a big smile?
Cranial nerve 7, the facial nerve, innervates all the muscles of facial movement and expressions. It also mediates taste sensation in the anterior 2/3 of the tongue.
Your taste, for example.
Taste? Something, 'cause I like spicy foods, and if it's not spicy, I usually don't taste it so well.
It's not as spicy anymore. Okay.
Cranial nerve 8, the acoustic nerve, also known as the vestibulocochlear nerve, mediates hearing and vestibular function. Assess hearing with the whispered voice test.
So can you just go ahead and close your right ear? Yeah, wonderful. I'm just gonna whisper something and you tell me what it is. Tomato.
Tomato.
Okay, now we're gonna switch and do the same on the other side. Okay. October.
October.
Thank you very much.
To test the vestibular function of the acoustic nerve, ask the patient to stand with their feet together and their eyes closed. Observe if they are able to maintain their balance without swaying. This assesses their ability to maintain balance with diminished visual input.
And I want you to just close your eyes and just stand for a couple of seconds. Okay, so you can open your eyes again and sit back down.
Cranial nerve 9 and 10, glossopharyngeal, and vagus nerves.
You can put your glasses back on. Okay. So now I'm going to ask you to open up your mouth and say, ah.
Ah.
You know what? I'm actually going to take the light. So I'm going to shine a light to see better. So again, do the same thing. Okay.
These nerves mediate the sensory and motor functions of the palate, pharynx, and larynx. Cranial nerve 11, spinal accessory nerve.
So now I'm going to ask you to lift your shoulders. Shrug your shoulders as hard as you can. Wonderful. Thank you. Now I'm going to ask you to turn your head towards my hand over here. Okay. And same over here. Okay. Thank you.
This nerve innervates the sternomastoid and upper trapezius muscles. Cranial nerve 12, hypoglossal nerve.
So now I'm going to ask you to open up your mouth and stick out your tongue. Okay, up, move your tongue up, down, and then side to side.
Inspect their tongue for atrophy or fasciculations.
Light, tight, dynamite.
Light, tight, dynamite.
Okay, thank you.
Next, we are going to assess the motor system.
So now what I'm going to ask you to do, go like this with your arms, okay? And push against me as hard as you can, okay? And now pull me towards you.
First, focus on body position and involuntary movements. Then assess muscle characteristics such as size, strength, tone, and presence of any involuntary movements. Observe the patient's body position. Test muscle strength and use the MRC, Medical Research Council, scale to grade the different levels of muscle strength. This is a standardized way to describe and quantify muscle strength.
Perfect. Okay, so I'm looking for any drift. Okay. Thank you very much. Now I'm going to do the muscle strength, but in your lower limbs, okay? Push against me over here, okay? And pull me towards you. Wonderful. So just push on the gas pedal hard, hard, hard. Okay, and I'll pull towards you. Just bend at the ankle, yeah. Wonderful, thank you so much.
Assess cerebellar function by performing balance and coordination movement testing. To assess gait, ask the patient to walk 3 to 6 meters, or heel-to-toe walking, and then return back to their starting point. Here, the patient's gait is smooth, rhythmic, and effortless, with a coordinated swing. You can also ask the patient to walk in a straight line in a heel-to-toe manner.
I'm just going to ask you to sit back down.
To assess coordination and skilled movements, ask the patient to perform rapid alternating movement tests.
Can you just do this with your
Hands?
yeah, as fast as you can. Okay, perfect. Now I'm going to ask you to do one more test. So you're going to look at my finger.
Finger to nose coordination.
Use your left pointer to touch my finger.
Any one, it doesn't matter.
Your pointer, your first finger. Yeah, touch it, and I'll touch your nose. And touch my finger. Okay, touch your nose. Touch my finger, touch your nose. Okay, touch your nose. Now we're going to do the same with this hand, okay? So again, touch my finger, touch your nose.
Assess for any tremors or hesitation.
Okay, thank you very much.
Next, we are going to assess sensation. There are 3 parts to a sensory assessment: superficial sensation, mechanical sensation, and tactile discrimination. Here, we will assess light touch. When assessing light touch, be sure to assess over several dermatomes in the upper and lower body. Be sure to compare your findings bilaterally.
Now, now,
Okay,
now, 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 now.
thank you.
Next, we are going to assess deep tendon reflexes.
So now I'm going to get
Have the patient seated or lying comfortably. You will use the reflex hammer to strike specific tendons while the muscle is slightly stretched. In patients where reflexes appear to be absent, you should ask them to grit their teeth or clench their hands in order to distract
We're
them.
going to start with the biceps reflex. So just focus on something else. You can look across the room, tell me about what you're planning to do next weekend, okay? So I'm just feeling for the tendon.
As you are assessing the reflexes, grade them on a standardized scale.
Okay, gonna do the same over here. Okay, so just relax, relax.
Start with the biceps reflex, C5 to C6.
I'm gonna do this one, so remember limp, limp, limp.
Then assess the triceps, C7 to C8.
Let it go. Let me hold your hand. Let your arm limp. If I let it go, I want it to fall.
It will.
Okay. Okay. Little more limp. Shake it out. Perfect. Okay. So now I'm gonna hit a tendon over here. So Erin.
Brachioradialis reflex, C5 to C6.
Okay. And I'm gonna do the same over here. Okay. Can you just grit your teeth like this? Grit your teeth and don't look at what I'm doing. Grit your teeth. Okay.
Then the patellar reflex, L2 to L4.
So you know what it can do to help me? It can do this and just focus on that. Can you do that with your hands? Yeah. I'm just gonna hit over here. Okay. I'm gonna do the same over here. Just pull those hands apart.
The Achilles reflex, L5 to S2.
And just pull those hands apart. Don't look at me. Look at Anne-Laurie over there in the corner. Okay. And we're gonna do the same over here, okay? So again, don't look at what I'm doing. And pull those hands apart.
The plantar reflex, L4 to S2.
Okay.